More than 13,000 Texans are in the hospital with COVID-19. This is a new record. That's worse than our summer spike, and it has health officials scrambling. This surge is happening right here in local hospitals. Admissions are up 140% from last month.
And today, Austin Public Health warned that beds in intensive care units are expected to run out in just 10 days.
KXAN's Avery Travis has a look at which resources are most needed and what happens when hospitals run out of room.
If you have to think about your breathing, then you have a problem, because breathing just comes naturally.
But not for asthmatics, COPD patients, babies in the NICU, and now COVID-19 patients. That's where respiratory therapists like Cheyenne Spivey step in. She says they've been busy, sometimes helping wean patients off the ventilator and recover, other times there for someone's last breath.
The patients are alone and they're scared, and we're usually the last people that see them alive in some cases.
Right now, the three major Central Texas hospital systems say 88% of their ICU beds are full, as are 79% of their total hospital beds. Austin Public Health is working with these hospitals to determine if or when they'll need to open an alternate care site, like the one already set up at the convention center. But Austin's top doctor maintains they're really more worried about staffing than space, as major cities around Texas experience surges.
What we experienced over the summer is nothing compared to what we will experience over the next 2 months if we don't change things very quickly.
For Spivey, it goes beyond her patients.
It's really emotional for me. And it was hard because I couldn't be there. I take care of these patients all the time, and I couldn't be there.
She lost her uncle and her grandmother last month after they contracted the virus.
It's serious, and a lot of people, unfortunately, they won't realize that until it affects them personally.
Avery Travis, KXAN News.
An Austin Public Health spokesperson says only patients who require basic care would be transferred to an alternative care site like the convention center. She says they would hire more healthcare workers to take care of them, but the number of workers needed would depend on the number of patients.
If hospitalizations continue to increase, local businesses will face stricter limitations within days. We're in Hospital Region O, where COVID-19 patients occupy almost 18% of all hospital beds. If that number stays above 15% for 7 days straight, businesses have to reduce capacity to 50%. Doctors and hospitals have to suspend elective procedures. 16 of the state's 22 hospital regions have already done this. That list includes Lubbock, Dallas, Fort Worth, Waco, San Antonio, and Houston. Laredo has the highest percentage of hospitalized COVID-19 patients with 41%. State data show there are only 24 hospital beds available there and 2 ICU beds.
Texas is seeing a sharp rise in the number of new COVID cases. The state reporting more than 26,000 new confirmed infections today. The daily average is now more than 15,000 over the last week. We're now also tracking the vaccination data here at KXAN.com. Just under 2% of Texans have gotten their first dose of the vaccine. No one has gotten fully vaccinated just yet in Texas, and sadly, Texas just passed more than 28,000 deaths from COVID-19 since the start of the pandemic. At our recent and current rate, we'll hit 29,000 lives lost by this Saturday.
Austin Public Health started vaccinating people against COVID-19. APH says it's vaccinated about 740 people who fall under Phase 1A of the state's vaccination plan. So that includes APH's own staff, Travis County Jail medical staff, long-term care facility workers, and residents not enrolled with a vaccine provider, first responders, and school nurses. The health department's deputy testing supervisor got his shot. He calls the vaccine a lifesaver.
The vaccine is not painful at all. It's definitely a lifesaver, and for longevity of life, it's encouraged that you take it.
As of now, APH says it doesn't have enough doses to vaccinate people in Phase 1B.